My name's Anita Barkin, and I'm the co-chair of the ACHA COVID-19 Task Force. I'm pleased to host this presentation on misinformation and disinformation from the COVID-19 Task Force's updated guidelines for fall 2022. I'm here with Dr. Tondra Moore, Executive Director of Health Services for Prairie View A&M University. Dr. Moore is a member of our COVID-19 task force and authored the section of the guidelines on the challenging topic of misinformation and disinformation. Tondra, thank you so much for joining us today. Please feel free to share with us the most important takeaways from the guidance that you wrote.
So this is a good opportunity for us to introduce a new topic into our discussion about COVID. And it's very important for us at this stage in the pandemic, or what we know to be coming soon, endemic, to really look at the impacts of misinformation and disinformation. And just for the purposes of making sure there's clarity, misinformation is the unintentional spread of false information, where disinformation is the intentional spread of false information. And it's unfortunate because what we have seen with this COVID pandemic is that both misinformation and disinformation have had an increased impact on the health behaviors that we've seen on our college campuses and in the population as a whole. More specifically, what we've seen is that individuals have been more resistant to actually take their advice and guidance from their healthcare professionals, from our national public health resources, and from science in general. And that has caused us not to have the uptake in the mitigation strategies that we would have liked, because it could have helped to really slow the spread of the virus within the community in general. And this is very important also because we know that there has been and a greater impact or a disparate impact on different populations based on misinformation and disinformation. And so going to the second point, the effects of misinformation and disinformation targeting these populations must be explored on the college campuses. Campuses should really think about having some strategies in place to help them look at the effects of misinformation and disinformation within these underserved populations of students on their campus, so that they can know how to really address it and to explore different strategies. I wanted to make sure that I was looking at some of the most recent information in preparing this, and there was actually a very recent poster presented by MD Anderson on looking at misinformation and disinformation and a potential strategy. And one of the things that they highlighted was that when you're looking at African American and Hispanic individuals, that there are some strategic benefits to actually developing your information in short, ethnically appropriate educational bites. And so these types of strategies are going to be very important for us to help overcome some of the struggles that we're having with COVID, as well as other public health issues that we will encounter. And one of the reasons why we have to look at this in college health, and this has not always been a concern of ours, is because misinformation and disinformation have really allowed the mistrust that certain populations have with the healthcare professionals to really heighten and increase. This is important for us, whereas it used to not be, because when students came to us at college, we were the people they listened to. But now that they have all of this information available on the internet, they don't necessarily think that we are going to be the most credible sources or the best source of information for them. So we're not those experts anymore. And so because that trust in us as the experts has dwindled some due to misinformation and disinformation during this pandemic, we're going to have to be very intentional about rebuilding trust with our student body to become those experts once again. And I thought it was really important if we think about how we might want to reframe our position with the students in rebuilding this trust, and think about what is going to be the purpose for us as college health professionals when it really comes to disseminating information. We all have a team of health educators, but it goes beyond the health educators, because we know our clinicians are very, very influential health educators on our campus. But we're going to have every single member of our health professional staff really think about what's the purpose. And I want to frame 3 different paradigms or perspectives to look at it to help really kind of get a grasp on that. So again, our students have the world at their fingers with their cell phones. They have the ability to access more information than ever before. However, our students are still learning to be responsible consumers of knowledge. So we have that responsibility to help teach them how to be that responsible consumer of knowledge. And in teaching them that, we help them to figure out how to filter out the misinformation and the disinformation from credible sources. Also, we know that our students prefer easily digestible bites of information, and that will cause them to discard some of our research, some of our more technical and more complex literature. So with that, what we really need to think about is getting that information and digesting it for them, and then communicating it to them in a way that they can digest it and they can receive it, because they understand that we've taken this more complex topic and broken it down into a way in which they understand it and they don't have the questions that they were having, because really that's what misinformation and disinformation has done. It's caused them to really question, do we know what we're talking about? Do we really have the answers, or can they find those answers? So we can help them with that. And the last thing is, we have to remember that our students still need help on understanding how to apply this information in their lives. It's very easy to get that information, but you don't always know what to do with it. And so if we help them understand how to weave this through the fabric of their lives, how doing these small steps, it's not just for your health, but you looking out for yourself protects the greater community at large. That if those bits of information will help us rebuild our trust within our student bodies and become more credible for them, and help them to filter out the misinformation and disinformation, to get back to understanding that ultimately we are here to help them. We are here to keep them healthy so that they can academically persevere and they can thrive. So that's the gist of what I have to offer. And I think those are the best tips. We have a lot of other tips and strategies available in the guidelines, but I think just helping to reframe it may help everyone see how we can really take hold of it. Thank you.
Thank you, Tondra, for sharing your expertise on this topic. And many thanks to our audience for watching this video. If you haven't accessed the updated ACHA fall guidelines, you can find these and other resources on the ACHA website. If you have specific questions, you can email us at contact@acha.org. And if you would like to join the discussion on this and other COVID-related issues, go to ACHA Connect. Thank you again for joining us.